Hi guys, I shouldn't have clapped. Hi guys, so today I'm going to be talking about how to deal with physically aggressive patients because unfortunately it's probably something that most nurses are going to encounter, and you know, we have to know how to deal with it and how to be safe about it. So first and foremost, your safety comes before the safety of your patients. Yes, we want to do everything for our patients. We want to keep them safe. But if a patient is coming at me with a, IV pole and they're swinging at me, my safety comes first and I am running away. I am getting myself safe. I'm not going to try and block the IV pole from that patient. It's always fun when you're coming onto your shift and you see the security guard or a few security guards standing outside your patient's room, and your supervisor says during your kind of shift report change, "Oh, by the way, this patient got really aggressive earlier. We had to put him in 4-point restraints. We had to give him Haldol." So just be extra careful. And being that I am a female and I am, on the smaller side, if there's a really aggressive patient that is like getting physical, I'm not going to really be able to handle it. Let's be honest here. If a patient's trying to punch me, I am going to get out of the way. I am not going to be able to like grab their hand and like pull it down. So yeah, there's that. But if you have a patient that is getting physically aggressive, one, look for the signs before they get physically aggressive. Can we do something about de-escalating them before they get to that point? Do they have a history of getting aggressive? Are they tend to get more aggressive in the night? Those are all things to be really aware of. Usually a patient doesn't just all of a sudden like start throwing punches. Usually there's kind of something that sets them off, or they kind of show these cues of being more agitated. Maybe they're yelling, maybe they're pacing, maybe they're fidgeting, something that kind of shows you that they're going to potentially be physically aggressive. Most important thing is if someone is getting escalated, get more people in the room, get more hands on. Never turn your back to your patient. Most facilities will offer you a violence prevention or training course on how to like prevent violence / deal with violence. And so one, I really recommend taking that. It teaches you like if a patient grabs your hair or tries to choke you or punch you, like moves to do. And let's be honest, we're never going to remember those moves when the situation comes, but it's good to know and have as background information in your head that hopefully sticks. It's important to call code gray or whatever your facility does for combative patients as far as codes and the colors, so that way you can get more people to that room, because like I said earlier, the more people you can have there, the better as far as your safety. Sometimes having more people there can make a patient more agitated, but if a patient is already physical, doesn't matter. There's going to be more people in there that are going to help you out. So if you have a patient who's getting aggressive, maybe you've tried talking them down, maybe you were able to try and give them Ativan or something like to help with anxiety, and that's not working, and they're starting to get physical and they're trying to harm themselves or you, the next thing is to go to restraints. In order to do restraints, it really depends on your policy, but most hospitals will let you, as a nurse, initiate restraints, and then you need to go get an order from the doctor. You have to have an order from the doctor to do restraints. The best way to do it is to have a lot of people there to, depending on how aggressive the patient is, to, hold limbs, make sure they're not slashing and being violent, and then to have one person or two people put the restraints on while everyone else is holding them down. I know this sounds really terrible, but that's, you have to be safe. You have to take care of yourself, and in the end, that's just what you have to do. Make sure you check with your hospital's policy on your restraints. You have to check them every so often. I haven't done that many restraints, so I believe it's every 2 hours or so. And you also need to be checking for circulation. You need to be checking for, patient's readiness to be off the restraints, because hopefully a patient is not in restraints for a super long time. But again, you have to do what you got to do. I hope this gives you a little insight on kind of what to do when you have an aggressive patient. Remember, your safety comes first. I cannot stress that enough. If the patient's getting aggressive, take care of yourself. Don't do something that you're going to get yourself hurt for. Thank you guys for watching this video. Give it a thumbs up and subscribe to my channel, and I'll see you next time. Bye.